Turning 65 and becoming Medicare eligible is a big milestone in our lives. Many people who are first Medicare eligible can become overwhelmed on exactly what to do. For most people, choosing your health insurance company or plan was never a big choice, meaning if you received health coverage through your employer, most of the options were pretty much chosen for you. You may have gotten a few choices between an HMO plan or a PPO plan, maybe a few choices for the size of your deductible, and some other differences as well. Many people also had a person in human resources that could help them and explain their choices. Many times when people first start looking at Medicare, it is simply because it's the first time they have ever had to do any of this all on their own. New Medicare beneficiaries are being bombarded by mail from insurance companies saying how their plan is the best. A little insight here: if you contact an insurance company directly, they will only be able to talk about their plan and how you fit into their plan. And this statement is very important, and I will get back to it in a little bit on why it is important. New Medicare beneficiaries are getting so much mail that many are actually throwing away their Medicare card when it comes in the mail. Medicare is mailing all of the documents they are required to send, and this is happening at the same time you're getting all this mail from all the insurance carriers. All of this is supposed to help you make a clear and wise selection with your Medicare choice, and what it usually does is it just causes more confusion. And what is scary is if you make the wrong choice at the beginning of Medicare, it can potentially negatively affect you for the rest of your life. So what are you supposed to do? Hi, I'm Duncan, independent insurance broker specializing in Medicare, and I help seniors across the country with their Medicare insurance. If you're new to the channel or haven't done so already, please subscribe to our channel and hit the little bell for notifications. To check Medicare Supplement rates, go to our special site for this at MedicareRateQuote.com. You can also call us directly at 800-910-3382 with any questions, or you can visit our main website at TrustedBenefitsDirect.com. You can also see what our clients say about us at MedicareTestimonials.com. I am making this video to give you clear guidance to make your best Medicare choice. First, we will talk about how to enroll in Medicare, and you may not need to enroll. You may be enrolled automatically into Part A and B of Medicare without you doing a single thing. We will discuss what Medicare Part C is, also called Medicare Advantage, and what the advantages and disadvantages are, what Medicare Part D prescription drug plans are, and also what Medicare Supplements are and how they work with Original Medicare. So if you have a pen and paper, get it out and get ready to take a few notes. And if you don't, go ahead and pause the video and go get a pen and paper because we're about to start. First, there are 3 ways to enroll in Medicare, and you have to do it through Social Security. I know that doesn't make a lot of sense, enrolling for Medicare through Social Security, but you don't actually have to enroll into Social Security to enroll into Medicare, but you do need to enroll by contacting Social Security in one of 3 ways. First, you can go to the Social Security office, and depending on when you are watching this video, that might not even be an option because of the coronavirus. Second, you can call Medicare, and the phone number is 800-772-1213, or the fastest and easiest way is to enroll online. I have made a website to help with enrolling online. The website is partbnow.com, and on that site there will be a button taking you directly to the site you need to enroll. I have also made a tutorial video walking you through the steps as well if you need a little bit of help. All the websites I talk about are in the description below this video. You also need to know everyone that paid into Social Security for 10 years or more is automatically enrolled into Medicare Part A. It is automatic, and you will receive a Medicare card about 3 months before you turn 65. Next, you don't need to enroll into Medicare Part B if you are already drawing Social Security benefits. If you are getting monthly benefits, Social Security will automatically enroll you into Medicare Part B and start taking your Part B premium from your monthly Social Security benefit in the month that you turn 65. And if you don't wish to have Medicare Part B, you will simply need to send back your card. If you are not drawing Social Security benefits and want to enroll in Medicare Part B, you will need to utilize one of the 3 ways to do so. Now let's talk about Medicare itself. If you didn't get a pen and paper, now is a great time. The first thing I want you to write down is the term Original Medicare. This is an extremely important term because you will have an opportunity to replace your original Medicare with a Medicare Advantage plan. Many people get a Medicare Advantage plan not knowing it is literally a replacement for original Medicare and has many different rules. Now, there isn't anything wrong with Medicare Advantage. We have hundreds of clients that have it. But many times people get into Medicare Advantage not knowing its limitations. But before we get to that, we need to discuss original Medicare. Original Medicare consists of Medicare Part A and Medicare Part B. You will want to write down that Medicare Part A has a $0 premium and that it is called hospital insurance. The monthly premium is $0 for those and or their spouses that paid into Social Security for 10 years or 40 quarters. You'll also want to write down that Part A in general is our inpatient services. A quick way to think about what Part A covers is it covers us when we go into a building and we stay overnight. Now, that's not 100% exactly the case, but if we go in a building and stay overnight, most likely it will be covered under Part A of Medicare. That is a quick and easy way to think about what Medicare Part A covers. And in general, it covers our inpatient hospital stays, skilled nursing facility care, hospice care, and home health care. Now, as you know, Medicare doesn't cover 100% of the bill. That is why Medicare Supplement plans are available to you and where we come in to help. There are deductibles and copays you are responsible for if you don't have a Medicare Supplement plan. And for example, and the costs that I talk about here are for 2020. And if you're watching this after 2020, they will be a little different. But when you enter the hospital, there is a $1,408 deductible you are required to pay each benefit period. This $1,408 covers the first 60 days of your stay. If you happen to be in the hospital for more than 60 days, there is additional money you will owe. For each day between 61 and 90, you are responsible for $352 per day. And if your hospital stay is over 90 days, you are responsible for $704 per day until you exhaust your lifetime maximum of hospital days. If you need to use a skilled nursing facility after your hospital stay, there is additional money you are going to be responsible for as well. Medicare covers us up to 100 days in a skilled nursing facility. Fortunately, the first 20 days have a $0 per day coinsurance. But for the next 80 days, or days 21 through 100 of your stay, you are responsible for $176 per day. And if you max that out, the 100 days, that is a total of $14,080. Now that's just Part A. Next, there's Part B. You'll want to write down that Part B, that it's called medical insurance, and it has a standard monthly premium in 2020 of $144.60 per month for individuals making less than $85,000 a year and couples making less than $170,000 a year. And if you happen to make more than $85,000 as an individual and more than $170,000 as a couple, the premium goes up from there, and we will provide a chart for this. It is important to know Medicare considers your income from 2 years prior when determining your Part B premium. It is easiest to think that Part B covers us when we go into a building and we come out the same day. It's our outpatient services. Again, this isn't 100%, but as a general rule, Part B covers when we go into a building and we come home the same day. Part B coverage includes, but it certainly isn't limited to, our doctor services, preventive care like cancer screenings, laboratory tests like getting our blood drawn, x-rays, MRIs, CAT scans, physical, occupational, speech therapy, durable medical equipment like wheelchairs and oxygen, and ambulance service. And like Part A, Part B has a deductible that must be paid and also has coinsurance. And this is really, really important on this next part. The coinsurance of Part B has no maximum on your out-of-pocket medical expenses. Unlike health insurance you have now that probably has a maximum you would pay in deductibles, copays, and coinsurance, and then the plan picks up 100% of the costs, Medicare has no maximums. You'll want to write down original Medicare has no maximums. You'll also want to write down the Part B deductible in 2020 is $198. The good thing is you only need to pay the deductible once per calendar year. And I get asked a lot if the Part B deductible is owed for each service you get. And I get this question because most people are used to having health insurance with high deductibles of $1,000, $3,000, and $5,000, and even higher. But the $198, that is once a year deductible. And it does fluctuate every year, and most of the time it goes up, but some years it actually goes down. But after the deductible of $198, there is a 20% coinsurance, and again, there's no yearly limit for what you pay out of pocket on this 20%. If you have a Part B claim of $1,000, then you would owe 20% or $200. This isn't a big deal for most people. But if something drastic happens, that 20% coinsurance can become quite burdensome for most people. What I described is Medicare A and B, and that's also known as Original Medicare. One of the reasons it is important, and I want you to write this down as well, is because Original Medicare has fixed costs. The term fixed cost is important when we compare Original Medicare to Medicare Part C, Medicare Advantage a little later. These fixed costs, they are regulated by Medicare, and Original Medicare allows you to see any doctor, hospital, provider in the United States without a referral that accepts Medicare. Next, we will talk about the Medicare Supplements or Medigap plans. You can get free quotes on Medicare Supplement plans at MedicareRateQuote.com. And the term Medigap and Medicare Supplement are interchangeable. Medicare Supplement plans are designed to pay the deductibles, copays, coinsurance where Medicare doesn't pay that we just talked about. Medicare Supplements are provided by private insurance companies. Examples of those costs a Medicare Supplement can pay for are the Part A deductible, which covers the first 60 days of an inpatient hospital stay. They can pay the coinsurance for hospital stays over 60 days. They can pay for additional days needed in the hospital that Medicare doesn't pay for. In addition, they can pay for the skilled nursing facility coinsurance of $176 per day for stays lasting between 21 and 100 days. They can also pay the Part B deductible, although only in very limited instances and in limited areas of the country do we recommend getting a plan that covers the Part B deductible. And Medicare, there's Medicare Supplement plans, they can also pay the entire 20% of Part B that Medicare doesn't pay for. In addition, there's also some other things that the Medicare Supplement plans will pay for that just don't need to be listed here. 95% of our clients get Plan G or Plan N Medicare Supplement. Plan G is very simple. It will pay every deductible, copay, and coinsurance Original Medicare doesn't pay for except for the Part B deductible, which in 2020 is $198. With Plan G, you know on your worst year, the most you would pay for your Medicare covered out-of-pocket medical costs would be your plan's monthly premium and a once per calendar year deductible of $198. Plan N is just a little different. It is the same as Plan G, but there are a few more payments you will be responsible for. And in return for being responsible for these payments, you will receive a lower monthly premium. The costs you are responsible for are first the Part B deductible, just like we talked about. Second, you will need to make copays for your doctor visits and copays for emergency room visits. And last, you are responsible for what's called excess charges, which I will explain momentarily. The copays you will be responsible to pay at the doctor's office will be up to $20. $20 is the maximum copay you can be responsible for at a doctor's office visit. And the copay depends on the service you receive at the doctor's office, but the max is $20. The same is the case with the emergency room, but the max copay you would be responsible for at the emergency room would be $50. Now let's talk about the excess charges. First to know about excess charges is there are very few providers that charge excess charge. A provider simply may charge 15% beyond what Medicare reimburses them for services. A provider may accept Medicare, but not accept Medicare as payment in full. If they don't accept Medicare as payment in full, they may charge an additional 15% beyond what Medicare pays them. If a provider charges this and you have Plan N, you will be responsible for this charge. As a quick note, and this isn't worth writing down, but the only plans that cover excess charges are Plan F and Plan G. And Plan F is very rarely worth purchasing. An important term to write down is Medicare Assignment. And the term Medicare Assignment is used when a provider accepts Medicare as payment in full. After I tell my clients what an excess charge is, they ask, well, how do I know if my doctor accepts Medicare Assignment? And it's pretty easy to look it up. Medicare has a tool called Physician Compare, and there is a link below this video to the video I made on how to use the website. This is where you can search for providers to see if they accept Medicare as payment in full. And like I mentioned, I've done a separate short video on how to use this tool to look up your doctors and providers. Now I want to quickly discuss how Medicare supplements are standardized. Medicare stipulates the benefits must be the exact same with each company. They can't differ. This is mentioned on page 9 of the official guide to buying a Medigap policy provided by Medicare. It states at the bottom of page 9, cost is usually the only difference between Medigap policies with the same letter sold by different insurance companies. This means the Medigap policy you buy with one company has the same exact medical benefits of another company for the lettered plan that you purchase. If you buy a Plan G with one company, you know the same basic medical benefits are the same for Plan G with another company. I get asked a lot, well, how am I going to know if my doctor takes the Medicare Supplement plan or Medicare Supplement company that I've chosen? And because Original Medicare is the primary insurance and your Medicare Supplement is the secondary insurance, no matter what Medicare Supplement company or plan you have picked, you have coverage at all doctors, hospitals, and providers that accept Original Medicare and have seen you for those services. If you see a doctor and they accept Original Medicare, your Medicare Supplement will cover the costs according to the plan that you purchase. Remember, we are independent agents and represent all the best Medicare Supplement companies. We represent companies like AARP United Healthcare, Anthem, Aetna, Blue Cross Blue Shield, Humana, Mutual of Omaha, Cigna, Transamerica, Manhattan Life, and the list is just too long to finish. Because we represent all these companies, we're able to shop all of the companies in just seconds. And this literally can save you hours of work. Could you imagine calling all of these companies to get a price quote for the plan that you're looking for? We can get you the price in seconds. Medicare also stipulates the premium for the plan you choose must be the same whether you use our free service or you go directly to one of the insurance companies. And again, you can get quotes at our website for this at MedicareRateQuote.com or simply call us at 800-910-3382. Now I will cover Medicare Part C and why the term Original Medicare is important and what happens when you call an insurance company directly. If you want to start looking up Medicare Advantage plans in your area, you can go to the website MedicareAdvantageStore.com. But before that, I'm going to take a quick break and get some water. But you don't need to worry because through the magic of video editing, this break is going to be instantaneous for you. I'll be right back. Okay, I'm back. I got myself a little bit of water, feeling a little bit better. Now I'm going to explain why the term Original Medicare is so very important. Next, we'll discuss Medicare Part C, and it is called Medicare Advantage. And it is a replacement for Original Medicare and is run by private insurance companies. I want you to write down this. You cannot have both Original Medicare and a Medicare Advantage plan. It is one or the other. Again, like I said earlier, there isn't anything wrong with Medicare Advantage plans. We have hundreds of clients with Medicare Advantage, but they have some rules that can make them extremely limiting. And remember how I said in the beginning how I would get back to what happens when you call an insurance company directly? An insurance company will attempt to steer you into a Medicare Advantage plan if they offer them, because they make the most money on these Medicare Advantage plans. And many times when a Medicare beneficiary enrolls into a Medicare Advantage plan directly through an insurance carrier, the rules of Medicare Advantage are not sufficiently explained. When our clients enroll into Medicare Advantage, I go through step by step the advantages and disadvantages of these plans because I don't want there to be any surprises. We don't steer our clients one way or the other. We present the facts about all the plans and provide our opinion when asked. And I'm going to supply my opinion here. When I am asked, should I keep Original Medicare or get a Medicare Advantage? In almost every case, I recommend keeping Original Medicare and getting a good Medicare Supplement. Remember when I said if you contact an insurance company directly, they will try to steer you towards Medicare Advantage because they make more money? Well, the insurance companies, they pay us higher commissions for these Medicare Advantage plans than they do the Medicare Supplements. And in almost every case, I recommend keeping Original Medicare and getting a good Medicare Supplement because in most cases, that is the best coverage for our clients. Next is the reason why I tend to recommend Medicare Supplement more often than Medicare Advantage. This is very important. I'm going to read this exactly as it appears on Medicare's website, and I will provide the link below this video. Medicare Advantage plans, sometimes called Part C or MA plans, are an all-in-one alternative to original Medicare. They are offered by private companies approved by Medicare. If you join a Medicare Advantage plan, you still have Medicare. I want you to notice that it doesn't say that you still have Medicare. But getting back to it, it says you still have Medicare. These bundled plans include Medicare Part A hospital insurance and Medicare Part B medical insurance, and usually Medicare prescription drug Part D. What that means is you get your Medicare Part A and Part B from the Medicare Advantage plan and not original Medicare. The Medicare Advantage plan decides what is covered, what is not covered, whether you need pre-authorization for services, etc. There are rules for Medicare Advantage, and I'm taking this from the Medicare website as well. Medicare pays a fixed amount for your care each month to the companies offering Medicare Advantage plans. These companies must follow rules set by Medicare. However, each Medicare Advantage plan can charge different out-of-pocket costs. Each plan can also have different rules for how you get services, like whether you need a referral to see a specialist, or if you have to go to doctors, facilities, or suppliers that belong to the plan for non-emergency or non-urgent care. And these rules can change every year. Remember how I said original Medicare has fixed costs? Well, each Medicare Advantage plan has different costs. With Medicare Advantage, you don't know what you will get year to year, or even a lot of times month to month. These doctor networks can change all of the time. Your doctor can come in and come out of the networks. And companies can leave the market altogether, and this happens more than you think. Medicare Advantage can be very unstable. Okay, it also states whether you need a referral to see a specialist. Almost all plans require a referral to a specialist. It also states Medicare Advantage plans can have a network of doctors, facilities, and suppliers that belong to the plan's network. Most of these Medicare Advantage plans, they're HMOs, and you need to see your primary care physician for referrals. And if you see a provider that is not in the network, you have absolutely no coverage unless it is an emergency. It is important to note that if you have an emergency inside the United States, the plan must cover you with no networks, and some plans, and not all the plans, will actually cover you for an emergency outside of the United States. So those are the major disadvantages in my opinion. But there are major advantages as well. These advantages are a lot of the plans have a low monthly premium, and in many cases a $0 monthly premium in addition to your Medicare Part B premium. You must always pay your Medicare Part B premium. We know Uncle Sam always going to get his money. Medicare Advantage plans can also offer additional benefits original Medicare doesn't cover, like gym memberships, vision, hearing, dental insurance, telephone appointments with doctors, and almost all plans include Part D prescription drug coverage as well. Medicare Advantage also has a maximum out-of-pocket for your deductibles, copays, and coinsurance. I get asked, when should I seriously look at getting a Medicare Advantage plan? Most of my clients that pick Medicare Advantage usually already have an HMO and were comfortable with the referral system. There are many videos from agents that just absolutely bash Medicare Advantage. Like I stated before, I think having original Medicare with a good Medicare supplement is better. But Medicare Advantage is a better option for a lot of Medicare beneficiaries. If you know the rules and are comfortable with the rules, they can be a great way to go. A lot of the time, they are zero premiums, include Part D drug coverage, and can have extras like dental, vision, hearing, gym memberships, and even more. If you think Medicare Advantage might be right for you, contact us. We will go over all of the disadvantages and advantages of all the plans available to you in your area. We want to help you make the best decision for your exact needs. The main disadvantages of Medicare Advantage Part C, in my opinion, are Part C takes away your freedom for you to see any doctor, hospital, or provider that accepts original Medicare without a referral or pre-approvals. By keeping your original Medicare A and B, you keep this freedom to see any doctor, hospital, provider that accepts Medicare without any referrals, and you have the opportunity to purchase a Medicare Supplement, also known as a Medigap plan, to help pay for the costs original Medicare doesn't pay for. That takes us through Part A, B, and C of Medicare, and also the Medicare Supplements. We will now finish with Part D prescription drug coverage. Part D of Medicare can be very confusing. In this video, I will be talking about the basics of Part D. I have made a more in-depth video about Part D, and the link is provided below this video. We provide free Part D analysis every year for our clients with Medicare Supplements, Part C Medicare Advantage, and standalone Part D prescription drug coverage as well. To start your research and start comparing prices of different Part D plans, you can visit our website at partdnow.com. We don't represent all Part D plans, and we do that for a reason. We have chosen the companies we want to do business with. If you are interested in seeing all of the carriers, that is very easy to do. Simply go over to Medicare's website and view all of the Part D plans that are available. Okay, let's get into the basics of Part D drug plans. Part D prescription drug coverage helps cover the cost of prescription drugs, including many recommended shots or vaccines. Part D plans are run by private insurance companies that follow rules set by Medicare. There are 4 stages for Medicare Part D drug plans, and Medicare sets limits for these stages during the year. The first stage is the deductible phase. The highest deductible Part D can have in 2020 is $435. Plans can waive that deductible entirely or can set the deductible at a lower limit. However, the deductible can be no higher than $435 on any Part D plan. Again, this is the deductible in 2020 and may be higher if you are watching this video after 2020. If your plan has a deductible, then you will pay 100% of your prescription costs until you have paid the entire deductible. It is important to ask if the deductible applies to all of the drugs. Some plans' deductibles only apply to brand name drugs and not generics. The second stage is the initial coverage limit. Once you have satisfied the deductible, if it applies, you will pay a copay or coinsurance for each medication you take based on what tier the prescription falls in. A quick example is you may have a $5 copay for generics, or maybe a $40 copay for brand name prescriptions. We will talk more about the tiers when we finish the 4 stages of Part D drug plans. Medicare is always tracking how much you pay and also how much the insurance company pays for your prescription drugs. Medicare sends you a statement on this every month. Before we talk about the next stage after the initial coverage phase, we must talk about the limits of the initial coverage phase. Like I said, Medicare is tracking how much you spend and how much your insurance company spends on the prescriptions. When that combined spending of you and the insurance company reaches $4,020 in 2020, then you move on to the next stage, which is called the coverage gap, also known as the donut hole. And before we talk about the coverage gap, let's give a quick example of how the combined spending in the initial coverage stage is figured, and it's not difficult. You combine the amount you pay for your prescription, this is your copay, plus the amount the insurance company pays for the prescription. For example, your copay may be $10, and the insurance company may pay $90. This is a combined payment of $100, and this is tracked for each prescription you get using your Part D drug plan. And when the total spending for all of your prescriptions by you and the insurance company reaches $4,020 in 2020, then you move on to the coverage gap stage. And the coverage gap has gotten less complicated over the last few years. Once you reach the coverage gap, you'll pay no more than 25% of the cost for your plan's covered brand name prescription drugs. An example is, if the plan pays $100 for a prescription, your cost will be 25% or $25 in this example. Although you'll pay no more than 25% of the price for brand name drugs, almost the full price of the drug will count to what's called your out-of-pocket costs. These out-of-pocket costs help you get out of the coverage gap, and I'll explain more about that in a bit. There is also a 25% cost for generics as well. If the cost of the generic is $10, then you will be responsible to pay $2.50 in this example. The rules for brand name and generic are the same, being you are responsible for paying 25%, but what is different is how the total cost is calculated in getting you out of the coverage gap. Almost the full cost of brand name drugs are applied to your out-of-pocket costs, meaning how much you pay and how much the insurance company pays are counted towards the out-of-pocket costs. However, only the 25% portion you pay for your generics is applied to your out-of-pocket costs. The way your out-of-pocket costs are calculated are important because this is the way it is determined how you move on to the last stage. The last stage, or stage 4 of prescription plans, is called the catastrophic phase. First important number you need to know is $6,350. When you have paid this amount out of your pocket for all of your prescriptions, this doesn't include the premium, you reach the stage 4, or the catastrophic phase. Once you reach this catastrophic phase of coverage, you are then responsible to pay 5% of the cost of the drug. If the cost of the prescription is $100, you pay $5. If the cost of the prescription is $1,000, you pay $50. That's pretty simple. I mentioned I would come back and talk about the different tiers. Each company has a formulary, which is just a fancy term for a list of prescriptions that are covered by the plan. Each company puts a prescription in a specific tier, and generally the higher the tier number, the higher the copay. In general, almost all Part D plans have a 5-tier system, and they go like this. Tier 1 is for preferred generics. Tier 2 is for regular generics. Tier 3 is for preferred brand name drugs. Tier 4 is for non-preferred brands. And Tier 5 is for what they call specialty drugs, and those are usually your injectables. Now, each company can place prescriptions in different tiers. You might be taking a generic drug, and with one company it's a Tier 1, and with another company it's a Tier 2. Or sometimes a prescription with one company is a Tier 4, and with another company, for whatever reason, it's a Tier 2. What we can do is help you compare the plans to help you find the lowest cost for all of your prescriptions. When shopping Part D plans, you need to take into account all of the costs. Many times people will purchase a plan with the lowest premium, say $20 per month, but the prescriptions they take are subject to a $435 deductible, and they never spend the $435 on their prescriptions to move out of the deductible stage. Let's say they spend $400 for the year on prescriptions, and the $20 per month is the premium. That is a total of $640 for the year. They may have been able to get a Part D plan that has a $40 a month premium with no deductible and had no copays for the prescriptions they took. Their overall spending would be $480 per year on the second plan and would have resulted in $160 a year savings. What I am illustrating is only an example to show how important it is to look at different Part D plans. In addition, not all plans have to cover the prescriptions that you take. You want to search for a plan that covers all of your prescriptions. We provide a free analysis of Part D plans for our Medicare Supplement and Medicare Advantage and Part D clients every year. We made it to the end. Thank you. Again, I am Chris Duncan, and I run an independent Medicare agency, and we help seniors all over the country. We don't work for the insurance companies, we work for you, and all of our services are free. Because we are independent, we get to represent many different companies to help you make the exact right decision for your needs. It is easy to contact us. You can do so toll-free at 800-910-3382. Get a free Medicare Supplement quote at MedicareRateQuote.com. You can fill out our contact form on our main website, TrustedBenefitsDirect.com. You can also start looking at Part D plans at PartDnow.com or start looking at Medicare Advantage plans at MedicareAdvantageStore.com. Also, please check out what our clients are saying about us at MedicareTestimonials.com. If you have any questions about this or any other questions about Medicare in general, we are here to help. We help with Medicare Supplement plans, Medicare Advantage Part C, Part D prescription drug plans, protecting retirees' retirement, and much more. If you found this information helpful, please subscribe to our channel. Please make a comment. I am curious to learn what you think about this subject, or share it to your social media like Facebook and Twitter. We are always putting out information and important news and updates to help with things like Medicare Basics, Medicare Made Clear, Medicare Explained, Medicare 101, and much more. Thanks again, and we'll be talking with you soon.